Dolo-neurobion tablets is used to relieve mild to moderate pain, including lumbalgia, radiculitis, spondylitis, neck pain, short pain, shouler-arm-syndrome, carpal tunnel syndrome, pain after surgery and other painful conditions. Contents: paracetamol, vitamin B complex. Dosage directions for use. Dolo-neurobion tablets should be taken orally. Adults, the elderly, and children and adolescents over 14 years of age take one tablet 1 to 3 times daily. The tablet should be swallowed without chewing with a little liquid after meals to minimize the effect of gastrointestinal irritation. The tablet should be taken every 4 to 6 hours. Do not exceed 4000 mg of paracetamol within 24 hours, 1 day. The duration of treatment should be as short as possible. If symptoms do not disappear, consult the physician. If the patient has forgotten to take Dolo-neurobion tablet, the patient should not make up for it by doubling the next dose. Simply take the dose at the usual time. Contraindications. The patient should not take this medicine if the patient has known allergies or hypersensitivity to any component of this product. This should not be given to children less than 14 years old due to the high content of the active ingredients. Special precautions. Under long-term use of high doses of vitamin B6, regular monitoring is recommended. This product is not intended to be used long-term. Paracetamol. Do not exceed the recommended dosage. Exceeding the recommended dose may result in severe liver impairment. Paracetamol should be given with precautions in following cases: hepatic insufficiency, chronic alcohol abuse, severe renal insufficiency. Adverse reactions. Vitamin B1, B6 and B12. Immune system disorders. Hypersensitivity reactions such as sweating, tachycardia, and skin reactions with itching and urticaria. Gastrointestinal disorders. Gastrointestinal complaints such as nausea, vomiting, diarrhea, and abdominal pain. Renal and urinary disorders. Hematuria, reddish urine appear during the first 8 hours after an administration and typically resolve within 48 hours. Paracetamol. Immune system disorders, hypersensitivity reactions, skin and subcutaneous tissue disorders, skin reactions, e.g. rash, urticaria. Gastrointestinal disorders, e.g. abdominal pain, nausea, vomiting. Blood and lymphatic system disorders, hematological reactions, e.g. leukopenia, thrombocytopenia. Hepatobiliary disorders, hepatic effect, e.g. increased level of aminotransferase, jaundice.